Hello everyone, Robert Riley here, and I wanted to share just a little bit of my experience of how I incorporated IVL into my clinical practice. Started using IVL during the Disrupt CAD3 study, and that was the pivotal study that here in the United States gained Shockwave IVL FDA approval in the coronary space. And we were lucky to be a part of that and enrolled a significant number of patients, and it was really during that time where I kind of fell in love with using the device. We would have these really crazy calcified lesions, and we'd kind of put this balloon down, and traditionally when we use balloons in this space, it didn't go so well, right? You'd either get inadequate expansion or you'd try really hard to get it to go really high or something else like that with a specialty balloon, and sometimes the best things didn't happen. But we would go to 4 atmospheres, deliver the pulses, and back then we would go to 6 after that. But it was always kind of like, really, this low atmospheres, this works? And you would see the balloon really sort of dog bony and kind of gnarly looking, when it would first start, and then as the pulses were delivered, you'd see slowly start to expand. And I remember the first couple of cases doing them with a senior partner of mine at the time, and it was amazing. I mean, watching it work. And I think that's when, especially after we put our imaging catheters in before and after, and really seeing these big old glaciers of calcium just fracture, like you'd taken a big bag of ice and just beat it on the ground. I mean, it was amazing. And then seeing these stent-like results almost after IVL before we'd even put the stent in, I mean, it was crazy. I mean, in lesions that had been really one of the hardest things to treat in the cath lab at that time. And so it was then when we started extrapolating it into all different types of spaces, whether it was CTOs, complex bifurcations, all these other things, that we really started to see how flexible the technology was. And that's when we started doing studies and different types of things to really see all of these different avenues. And, it really went from, hey, let's see how this goes in the study, to, oh my gosh, we can use these in so many different iterations. And so it's been a really fun journey, and I hope that you guys can relate to some of that.